And now we're moving on to EMFACE, really. And I'm going to get Matěj to tell us all about this.
Maybe I would like to add, before getting a bit deeper, to add one more point to your comparison with the M-Skull Neo. Because of course, we don't want to burn fat on the patient's cheeks. We don't want to get rid of the natural filler in your cheeks, of course. And secondarily, why we are not using the same technology, that one which is our own, of course, developed by BTL, on the face, because in that one, you want to employ all the muscles in your abdominal area, like the strong muscles, everything bulky. But on the face, we have to be, and the keyword here is selective. We only want to selectively stimulate the muscles that are responsible for the lifting effect. They are so-called elevators. So in case of the forehead, it's frontalis, zygomaticus minor, major, and risorius. And these are the only muscles we want to stimulate. So no depressors, nothing like that. We want to see more happy faces. And the science behind how we do that is that these applicators, they are emitting two different energies, two technologies. First is radio frequency. This is first of all, very nice sensational feeling, no more than 40 degrees, 20 minutes. It's like called sous vide cooking by some of the patients, very like slow, painless sensation. And it helps with collagen, elastin, fewer wrinkles. This is clear for everybody. But what is, in my personal opinion, more interesting is the muscle stimulation that works similarly to M-Skull Neo in a way that it bypasses the brain, again employs 100% capacity of your muscles, and it literally makes your facial muscles like dance and makes them tone them, because as we age, everything in the face is subject to facial aging, everything sags down, and because the muscles are the underlying structures on your face, we are actually the only ones to do the facelift from like ups from the below levels and bring everything up non-surgically. It works miracles, and we have everything backed by science, 10 clinical studies, histologies, CTs, 3D scans, ultrasound, you name it.
And I think the feedback that I hear from facial plastic surgeons as well really emphasizes exactly what you've just said. This isn't just the non-surgical domain really sort of attesting to the power of this device. I've heard facial surgeons say, you know, this is the first time we've seen a device that can do essentially what my scalpel can do. You know, we are lifting and repositioning that muscle, albeit through a completely pain-free, non-surgical device. And actually, I find these applicators fascinating because they're light years away, obviously, from the ones that we're placing on the body, right? Yeah. They're so super lightweight and comfortable. And can you tell us a little bit about sort of what they're made from, how they're working, what placement they've sort of been positioned in?
Yeah, they are actually 5 different layers. Some of them emitting the radio frequency, also the muscle stimulation called HIFES, the abbreviation, that's not important, but also the hydrogel, 5 different layers that conducts the electricity. There's a lot of science behind it. I just don't want to get too technical, to be honest. We would spend an hour me talking here. This is not very interesting, I believe.
But it's amazing because, I know, very interesting to us, but also fascinating because it essentially just looks like she's wearing a sort of face mask, a sheet mask. But like you said, there's so much science sort of packed into these little patches.
What's the most important part for the patient in terms of the results and also patient's comfort is that they are actually divided into 6 segments. I will take the forehead one. So we are on the forehead employing or emitting the radio frequency for more collagen, more elastin, fewer wrinkles, like everywhere. But because we know facial anatomy very well, or our experts, they know it very well, we are emitting the muscle stimulation only on those parts, not here, only here, because this is what creates the lifting effect on your face. The glabellar region muscle are not stimulated. And what we love about it as well is that one doesn't have to be, even though Dr. Sherina is, one doesn't have to be a super skillful facial anatomist to do the treatment properly. And this is why it delivers consistent, amazing results to all the patients across the board globally.
I also think it's filling up that really sort of niche where you have the slightly younger patient who maybe isn't quite ready for injectables or doesn't want them, and this is providing to be a really sort of nice alternative to those treatments.
And I would love to add to that because it is a complement to those treatments. And I love to start with a younger person or younger patient because they already have a stash and a stock of existing collagen, elastin, and hyaluronic acid. So you tend to have more that you're able to work with. And I think Matěj alluded to this concept of not just thinking about the skin and the muscle. Those are 2 out of the 5 layers of aging of the face. You've got your skin, you've got your superficial fat, you've got your muscles, you've got your deep fat, and then finally you have your skeletal platform. But they're all held together with anchors. It's what we call connective tissue, and it's all of those connective tissues that are just kind of woven together really beautifully, like layers of a sandwich all stuck together. But unfortunately, as we age, all of our layers are decreasing in volume, in consistency, in tone, in hyaluronic acid, in fluid consistency, and they'll start to fall off the face in a very predictable way. So by heating up the collagen elastin at the top layer, as well as the muscle, and through all of the heating of the connective tissue, you're literally pulling back the face and strapping it back onto the skull. That's as descriptive as it literally is. That version of John Travolta's Face Off, but face back on. I love John Travolta, so, you know, that's how I look at it. And where my facial injectables will then fit in at the end is literally pinning things back in place. And if I look at someone as beautiful as Fliss down here, and Flissy doesn't look like she's had any work done, so a treatment like this is perfect. And you've had this before, Fliss, haven't you? What did you think? Do you mind me asking you?
It's really nice. It's a really comfortable feeling. And it definitely has results after one.
What did you notice?
Well, that my cheeks bones were higher and my face felt more lifted. Yeah.
Did you have it again?
Absolutely, yeah.
Yes. Did you give up your fillers?
Yes.
Wow, that's a big... Would she give up her fillers? Yes, gosh. So this is really interesting, and I think we're seeing a shift in paradigm also in patients looking for a needle-free, knife-free, scar-free, downtime-free. She's literally got her leggings on. She's got to go back to her yoga teaching. So patients don't have that time for downtime. But I think the beauty is we're looking beyond a magnetic stimulation, because this is now an electrical stimulation. And I love hearing the precision as a practitioner, because we're literally using an electrical circuit in a very concise way, targeting the frontalis and the 2 cheek elevators and this Wallace and Gromit muscle here called the risorius. And that is so precise. We don't want to target the downward muscles. We don't want to target that muscle. We certainly don't want to target the jawline muscles, because our patients are clenching too much already. And the beauty is, it's also working on that plastic surgeon's layer called the SMAS. When we work on the SMAS, we're seeing this pulling up and out and a rotation of the whole face beyond just a lifting. It really is resetting the facial platform.